Hello, future healthcare professionals. Welcome to Nursing Exam Preparation, your ultimate resource for mastering the intricacies of reproductive health. In today's video, we'll guide you through 250 true-false questions focused on the reproductive system, a crucial area of study that forms the foundation for understanding human biology and reproductive care. Each question has been carefully designed to assess your understanding, reinforce key concepts, and help you build a solid foundation in reproductive anatomy, physiology, and health. After every question, we'll provide a detailed rationale behind the correct answer, ensuring that you not only know the right answer, but also understand the reasoning behind it. Whether you're just starting to study reproductive health or gearing up for your exams, this video is packed with essential knowledge to boost your confidence, improve your clinical reasoning, and set you on the path to success. Don't forget to like, share, and subscribe to Nursing Exam Preparation for more valuable content to support your learning journey. Hit the bell icon to stay updated with our latest videos. Our goal is to help you succeed with engaging, practical resources. Once you've completed the quiz, share your score in the comments below. We're eager to celebrate your progress. Let's dive in and take the next step toward becoming a well-rounded healthcare professional with a strong understanding of the reproductive system. 1. The ovaries are responsible for the production of estrogen and progesterone. True or false? Answer: true. Rationale: the ovaries are primary reproductive organs in females and are responsible for producing the hormones estrogen and progesterone. These hormones regulate the menstrual cycle, support pregnancy, and influence secondary sexual characteristics. 2. The seminiferous tubules are the site of sperm maturation in the male reproductive system. True or false? Answer: false. Rationale: the seminiferous tubules are the site of spermatogenesis, where sperm are produced. However, sperm maturation occurs in the epididymis, where sperm gain motility and the ability to fertilize an egg. 3. Ovulation typically occurs on day 14 of a 28-day menstrual cycle. True or false? Answer: true. Rationale: in a regular 28-day menstrual cycle, ovulation usually occurs around day 14, when a mature egg is released from the dominant follicle in the ovary. This is driven by a surge in luteinizing hormone LH. 4. The prostate gland is responsible for producing most of the fluid in semen. True or false? Answer: true. Rationale: the prostate gland produces a significant portion of seminal fluid, which helps nourish and protect sperm. This fluid contains enzymes, citric acid, and zinc, essential for sperm motility and function. 5. Fertilization typically occurs in the uterus. True or false? Answer: false. Rationale: fertilization typically occurs in the fallopian tube, not the uterus. The sperm meets the egg in the tube, and the fertilized egg then travels to the uterus for implantation. 6. The corpus luteum secretes progesterone to maintain pregnancy during the first trimester. True or false? Answer: true. Rationale: after ovulation, the ruptured follicle becomes the corpus luteum, which secretes progesterone. Progesterone supports the early stages of pregnancy by preparing the uterine lining for implantation and preventing further ovulation. 7. A vasectomy is a surgical procedure that prevents sperm from entering the urethra. True or false? Answer: true. Rationale: a vasectomy involves cutting or blocking the vas deferens, the ducts that carry sperm from the testes to the urethra. This prevents sperm from being included in semen during ejaculation, rendering the person sterile. 8. Polycystic ovarian syndrome, POS, can lead to irregular menstruation and infertility. True or false? Answer: true. Rationale: POS is a common endocrine disorder that can result in irregular menstrual cycles, anovulation, lack of ovulation, and infertility. It is often associated with elevated levels of androgens, male hormones, and cysts in the ovaries. 9. During male puberty, the testes decrease in size and become less active in sperm production. True or false? Answer: false. Rationale: during puberty, the testes increase in size and become more active in sperm production due to the rising levels of testosterone, which triggers the development of secondary sexual characteristics and spermatogenesis. 10. The luteal phase of the menstrual cycle occurs after ovulation and lasts about 14 days. True or false? Answer: true. Rationale: the luteal phase follows ovulation and lasts approximately 14 days. During this phase, the corpus luteum produces progesterone, which maintains the uterine lining in case of pregnancy. If fertilization does not occur, progesterone levels fall, leading to menstruation. 11. An ectopic pregnancy occurs when the fertilized egg implants outside the uterus. True or false? Answer: true. Rationale: an ectopic pregnancy is when a fertilized egg implants in a location other than the uterus, most commonly in a fallopian tube. This can be life-threatening for the mother if not diagnosed and treated early. 12. The human chorionic gonadotropin, HCG, hormone is produced by the developing embryo after fertilization. True or false? Answer: true. Rationale: HCG is produced by the trophoblast cells of the embryo shortly after implantation. It helps maintain the corpus luteum, which produces progesterone to support the pregnancy in its early stages. 13. Menopause marks the end of the menstrual cycle and a woman's reproductive years, typically around age 50. True or false? Answer: true. Rationale: menopause is diagnosed when a woman has not had a menstrual period for 12 consecutive months, typically occurring around age 50. It is associated with a decline in ovarian function and a decrease in estrogen levels. 14. The endometrium is the inner lining of the uterus, which thickens and sheds during the menstrual cycle. True or false? Answer: true. Rationale: the endometrium is the inner lining of the uterus, which thickens in response to hormonal signals to prepare for implantation. If pregnancy does not occur, the lining sheds, resulting in menstruation. 15. In males, LH stimulates the production of testosterone by the Leydig cells in the testes. True or false? Answer: true. Rationale: luteinizing hormone LH stimulates the Leydig cells in the testes to produce testosterone, a hormone crucial for spermatogenesis and the development of male secondary sexual characteristics. 16. Endometriosis is a condition where tissue similar to the uterine lining grows outside the uterus, leading to pain and possible infertility. True or false? Answer: true. Rationale: endometriosis occurs when endometrial-like tissue grows outside the uterus, often on the ovaries, fallopian tubes, and pelvic organs. This condition can cause severe pain, especially during menstruation, and may lead to infertility. 17. The male reproductive system produces eggs for fertilization. True or false? Answer: false. Rationale: the male reproductive system produces sperm, not eggs. Eggs are produced by the female ovaries, while sperm are produced in the male testes. The two gametes combine during fertilization to form a zygote. 18. The acrosome of a sperm cell contains enzymes that help it penetrate the egg during fertilization. True or false? Answer: true. Rationale: the acrosome is a cap-like structure on the sperm head that contains enzymes, such as hyaluronidase, which help the sperm penetrate the egg's protective layers during fertilization. 19. The fertilized egg, or zygote, undergoes cleavage and forms a blastocyst before implantation into the uterine wall. True or false? Answer: true. Rationale: after fertilization, the zygote undergoes cleavage, a series of cell divisions, to form a blastocyst. The blastocyst then implants into the uterine wall, marking the beginning of pregnancy. 20. Men have a finite number of sperm throughout their lives, and sperm production decreases with age. True or false? Answer: false. Rationale: unlike females, men can produce sperm throughout most of their lives. While sperm production does decrease with age, it is not finite, and men can continue to produce sperm well into older age, though fertility may decline. 21. The epididymis is responsible for sperm production in males. True or false? Answer: false. Rationale: the epididymis is responsible for the maturation and storage of sperm, not their production. Sperm are produced in the seminiferous tubules of the testes. 22. The menstrual cycle typically lasts 21 to 35 days in most women. True or false? Answer: true. Rationale: the menstrual cycle can vary in length, but a typical cycle usually lasts between 21 and 35 days. It is controlled by hormonal fluctuations, including estrogen and progesterone. 23. Testosterone is essential for the development of female secondary sexual characteristics. True or false? Answer: false. Rationale: testosterone is primarily responsible for male secondary sexual characteristics. In females, estrogen and progesterone are responsible for traits such as breast development and menstrual cycles. 24. The fallopian tubes transport the egg from the ovary to the uterus. True or false? Answer: true. Rationale: the fallopian tubes, also called oviducts, are the pathways through which the egg moves from the ovary to the uterus. This is also where fertilization typically occurs. 25. The cervix is the lower part of the uterus that connects to the vagina. True or false? Answer: true. Rationale: the cervix is the lower part of the uterus that leads into the vagina. It plays a key role during childbirth and menstruation, and also produces mucus that helps with sperm transport. 26. A woman can still menstruate if she is pregnant. True or false? Answer: false. Rationale: once a woman is pregnant, menstruation ceases. The body produces human chorionic gonadotropin, HCG, to maintain the corpus luteum, preventing the shedding of the uterine lining. 27. The menstrual phase is characterized by the shedding of the endometrial lining. True or false? Answer: true. Rationale: the menstrual phase is the first phase of the menstrual cycle, during which the endometrial lining is shed due to the drop in progesterone levels if pregnancy has not occurred. 28. The prostate gland contributes to the formation of the blood-testis barrier. True or false? Answer: false. Rationale: the blood-testis barrier is formed by tight junctions between Sertoli cells in the testes. The prostate gland produces seminal fluid, not the blood-testis barrier. 29. Sperm production begins at puberty and continues throughout life. True or false? Answer: true. Rationale: sperm production, or spermatogenesis, begins at puberty and continues throughout most of a male's life, although the rate and quality of sperm production may decline with age. 30. The hymen is an anatomical structure found around the cervix. True or false? Answer: false. Rationale: the hymen is a thin membrane located at the entrance of the vagina, not around the cervix. It is often associated with virginity but can be stretched or torn due to various physical activities. 31. In males, FSH, follicle-stimulating hormone, stimulates sperm production. True or false? Answer: true. Rationale: follicle-stimulating hormone, FSH, in males stimulates Sertoli cells in the seminiferous tubules, promoting spermatogenesis, sperm production. 32. In the female reproductive system, estrogen is primarily responsible for the maturation of the oocyte. True or false? Answer: true. Rationale: estrogen is responsible for the maturation of the oocyte, egg, during the follicular phase of the menstrual cycle, as well as the development of secondary sexual characteristics in females. 33. The blastocyst is the first stage of fetal development after fertilization. True or false? Answer: true. Rationale: the blastocyst is a structure formed after the zygote undergoes cleavage and reaches the uterus. It implants into the uterine lining, marking the beginning of pregnancy. 34. The zona pellucida is a protective layer surrounding the egg that is crucial for fertilization. True or false? Answer: true. Rationale: the zona pellucida is a glycoprotein layer surrounding the oocyte. It plays a critical role in fertilization by enabling sperm binding and triggering the acrosomal reaction. 35. Progesterone levels drop when pregnancy occurs. True or false? Answer: false. Rationale: progesterone levels increase during pregnancy to maintain the uterine lining for embryo implantation. If pregnancy does not occur, progesterone levels drop, leading to menstruation. 36. The urethra in males serves only as a passage for urine. True or false? Answer: false. Rationale: The male urethra serves as a passage for both urine and semen. It transports urine from the bladder and semen from the reproductive system during ejaculation. 37. A female baby is born with all the eggs she will ever have in her ovaries. True or false? Answer: true. Rationale: females are born with all the oocytes, eggs, they will ever have, stored in the ovaries. These oocytes are arrested in the prophase stage of meiosis until they are ovulated during the reproductive years. 38. The placenta acts as an endocrine organ during pregnancy, producing hormones like HCG and progesterone. True or false? Answer: true. Rationale: the placenta produces hormones like human chorionic gonadotropin, HCG, and progesterone to support pregnancy, maintain the uterine lining, and prevent ovulation during pregnancy. 39. Spermatogenesis occurs at a constant rate throughout the male's reproductive life. True or false? Answer: false. Rationale: spermatogenesis occurs throughout a male's life, but the rate of sperm production decreases with age. As men age, sperm motility and DNA integrity may decline. 40. The clitoris is part of the female reproductive system, but does not play a role in sexual arousal. True or false? Answer: false. Rationale: the clitoris is a highly sensitive organ located at the top of the vulva. It plays a significant role in sexual arousal and pleasure due to its high concentration of nerve endings. 41. In males, the acrosome is involved in sperm motility. True or false? Answer: false. Rationale: the acrosome is involved in sperm fertilization, not motility. It contains enzymes that help the sperm penetrate the egg during fertilization. Motility is primarily facilitated by the tail, flagellum, of the sperm. 42. The vulva is the external part of the female genitalia. True or false? Answer: true. Rationale: the vulva includes the external structures of the female genitalia, including the labia, clitoris, and vaginal opening. It is distinct from the internal reproductive organs like the uterus and ovaries. 43. The zona pellucida becomes thinner after fertilization, allowing embryo implantation. True or false? Answer: true. Rationale: after fertilization, the zona pellucida undergoes changes that prevent additional sperm from entering the egg. It also thins to allow the embryo to hatch and implant into the uterine lining. 44. The testes are located outside the male body to maintain an optimal temperature for sperm production. True or false? Answer: true. Rationale: the testes are located in the scrotum outside the body to keep the temperature slightly lower than the body's core temperature, which is necessary for optimal sperm production. 45. The urethra is longer in females than in males. True or false? Answer: false. Rationale: the urethra is shorter in females than in males. It is about 3 to 4 centimeters long in females, compared to 18 to 20 centimeters in males. This difference is one reason why women are more prone to urinary tract infections. 46. The placenta provides nutrients and oxygen to the developing fetus and removes waste products. True or false? Answer: true. Rationale: the placenta acts as a nutrient and gas exchange organ, providing the developing fetus with oxygen and nutrients while removing carbon dioxide and waste products. 47. During ejaculation, sperm are propelled from the vas deferens to the urethra by smooth muscle contractions. True or false? Answer: true. Rationale: smooth muscle contractions in the vas deferens propel sperm into the urethra during ejaculation, where they are mixed with seminal fluid from accessory glands before being expelled. 48. Women experience menopause due to a decrease in the number of follicles in the ovaries. True or false? Answer: true. Rationale: menopause occurs when the ovarian reserve of eggs is depleted, leading to a decrease in estrogen production and the cessation of menstruation. This typically happens around age 50. 49. A fertilized egg can implant into the fallopian tube in a normal pregnancy. True or false? Answer: false. Rationale: a fertilized egg should implant into the uterine lining, not the fallopian tube. If implantation occurs in the tube, It results in an ectopic pregnancy, which is a medical emergency. 50. In the male reproductive system, the bulbourethral glands produce the majority of semen. True or false? Answer: false. Rationale: the majority of semen is produced by the prostate gland and seminal vesicles. The bulbourethral glands produce a small amount of clear fluid that lubricates the urethra before ejaculation. 51. Sperm cells are produced in the seminiferous tubules of the testes. True or false? Answer: true. Rationale: the seminiferous tubules are the site of spermatogenesis in the male testes, where sperm are produced. 52. Menstruation is triggered by a sudden increase in estrogen levels. True or false? Answer: false. Rationale: menstruation is triggered by a drop in estrogen and progesterone levels after the luteal phase ends, signaling the shedding of the endometrial lining. 53. The vagina serves as the site of sperm deposition during intercourse. True or false? Answer: true. Rationale: during intercourse, sperm are deposited in the vagina, where they travel through the cervix into the uterus and fallopian tubes to potentially fertilize an egg. 54. The prostate gland enlarges with age, which can lead to urinary problems in men. True or false? Answer: true. Rationale: the prostate gland often enlarges as men age, a condition known as benign prostatic hyperplasia, BPH, which can obstruct urine flow and cause urinary symptoms. 55. The antral follicle is the stage of the oocyte before ovulation. True or false? Answer: true. Rationale: the antral follicle is the stage of follicular development before ovulation, characterized by the presence of a fluid-filled antrum. 56. The Sertoli cells in the testes support and nourish developing sperm cells. True or false? Answer: true. Rationale: Sertoli cells, located in the seminiferous tubules of the testes, provide nourishment and structural support for developing sperm cells during spermatogenesis. 57. Progesterone is responsible for initiating labor during pregnancy. True or false? Answer: false. Rationale: progesterone maintains pregnancy by preventing premature uterine contractions. Labor is initiated by a complex interaction of hormones, including oxytocin and prostaglandins, which promote uterine contractions. 58. A fertilized egg, or zygote, contains 23 chromosomes from the sperm and 23 chromosomes from the egg. True or false? Answer: true. Rationale: a zygote is formed when a sperm cell and an egg cell each contribute 23 chromosomes, combining to form a total of 46 chromosomes, which is the typical number for human cells. 59. The menstrual cycle includes 4 distinct phases: menstrual, follicular, ovulation, and luteal. True or false? Answer: true. Rationale: the menstrual cycle is divided into 4 phases: the menstrual phase, follicular phase, ovulation, and luteal phase, each regulated by hormonal fluctuations. 60. The testes produce both sperm and testosterone. True or false? Answer: true. Rationale: the testes are responsible for producing sperm through spermatogenesis and testosterone, which is crucial for the development of male secondary sexual characteristics and spermatogenesis. 61. Ovulation occurs when the corpus luteum ruptures and releases an egg. True or false? Answer: false. Rationale: ovulation occurs when the dominant follicle ruptures to release an egg from the ovary, not the corpus luteum. The corpus luteum forms after ovulation and secretes progesterone to support pregnancy. 62. Human papillomavirus, HPV, is a common sexually transmitted infection that can cause cervical cancer. True or false? Answer: true. Rationale: certain strains of HPV are linked to cervical cancer, making HPV vaccination important for preventing this cancer in women. Regular screening, like Pap smears, can detect early changes in cervical cells. 63. The uterus has 3 layers: the endometrium, myometrium, and perimetrium. True or false? Answer: true. Rationale: the uterus consists of 3 layers: the inner endometrium, which thickens for pregnancy, the middle myometrium, muscle layer responsible for contractions, and the outer perimetrium, the serous outer layer. 64. The hypothalamus regulates the release of hormones from the ovaries and testes. True or false? Answer: true. Rationale: the hypothalamus produces gonadotropin-releasing hormone, GnRH, which regulates the release of luteinizing hormone, LH, and follicle-stimulating hormone, FSH, from the pituitary, controlling ovarian and testicular function. 65. The bulbourethral glands secrete a viscous fluid that neutralizes acidic urine in the urethra. True or false? Answer: true. Rationale: the bulbourethral glands secrete a clear, viscous fluid that neutralizes any residual acidity in the male urethra, providing a more suitable environment for sperm during ejaculation. 66. The placenta is the structure that connects the developing fetus to the uterine wall. True or false? Answer: true. Rationale: the placenta is the organ that provides nutrients, oxygen, and waste exchange between the mother and fetus during pregnancy, while also secreting hormones to maintain the pregnancy. 67. The male prostate gland is part of the endocrine system. True or false? Answer: false. Rationale: the prostate gland is part of the male reproductive system, not the endocrine system. It produces seminal fluid, but does not secrete hormones like an endocrine gland. 68. The vagina is lined with stratified squamous epithelium to protect against physical stress. True or false? Answer: true. Rationale: the vaginal lining consists of stratified squamous epithelium, providing protection against physical stress, friction, and infections during sexual activity and childbirth. 69. The zona pellucida prevents multiple sperm from fertilizing the same egg. True or false? Answer: true. Rationale: the zona pellucida undergoes changes after the first sperm penetrates, preventing other sperm from entering the egg, a process known as the cortical reaction. 70. The vas deferens is responsible for the storage of sperm in males. True or false? Answer: false. Rationale: the epididymis is responsible for storing sperm. The vas deferens transports sperm from the epididymis to the urethra during ejaculation. 71. Sperm production in males begins at birth and continues throughout their lives. True or false? Answer: false. Rationale: sperm production begins at puberty, not at birth. Before puberty, males do not produce sperm, though they do produce testosterone. 72. The corpus luteum secretes estrogen after ovulation to maintain pregnancy. True or false? Answer: false. Rationale: the corpus luteum primarily secretes progesterone after ovulation, not estrogen. Progesterone supports the uterine lining for embryo implantation and pregnancy maintenance. 73. Women are born with all the eggs they will ever have, which decreases over time. True or false? Answer: true. Rationale: females are born with a finite number of eggs, which decrease in number as they age. By puberty, only a fraction of the original number of eggs remains. 74. The testes are responsible for producing both testosterone and sperm. True or false? Answer: true. Rationale: the testes produce sperm through spermatogenesis and testosterone, which plays a crucial role in male sexual development and fertility. 75. The cervix dilates to allow sperm to pass into the uterus during intercourse. True or false? Answer: false. Rationale: the cervix does not dilate during intercourse. It remains closed during most of the menstrual cycle, but it dilates during labor to allow the passage of the baby. 76. An ectopic pregnancy occurs when a fertilized egg implants in the fallopian tube. True or false? Answer: true. Rationale: an ectopic pregnancy occurs when the fertilized egg implants outside the uterus, most commonly in the fallopian tube. This can be life-threatening if not treated. 77. The testes develop in the abdominal cavity and descend into the scrotum before birth. True or false? Answer: true. Rationale: the testes initially develop in the abdomen and typically descend into the scrotum around the 7th month of fetal development, where they remain to maintain a cooler temperature for sperm production. 78. The labia majora is the external genitalia of males. True or false? Answer: false. Rationale: the labia majora are part of the female external genitalia. The male equivalent is the scrotum. 79. During pregnancy, the mother's blood supply directly mixes with the fetus's blood through the placenta. True or false? Answer: false. Rationale: the mother's and fetus's blood do not mix directly. The placenta allows the exchange of nutrients and gases across a barrier without direct mixing of blood. 80. The acrosome reaction allows sperm to penetrate the egg's outer membrane during fertilization. True or false? Answer: true. Rationale: the acrosome reaction is a process in which enzymes from the acrosome, a cap on the sperm's head, break down the egg's protective layers, allowing the sperm to penetrate and fertilize the egg. 81. The corpus luteum forms after fertilization and secretes progesterone to support pregnancy. True or false? Answer: true. Rationale: the corpus luteum forms after ovulation and secretes progesterone, which is essential for maintaining the uterine lining for embryo implantation and early pregnancy. 82. The scrotum helps regulate the temperature of the testes, which is essential for sperm production. True or false? Answer: true. Rationale: the scrotum holds the testes outside the body to maintain a temperature lower than the body's core temperature, which is necessary for optimal sperm production. 83. In females, the luteal phase occurs before ovulation. True or false? Answer: false. Rationale: the luteal phase occurs after ovulation. It begins after the release of the egg and involves the formation of the corpus luteum, which secretes progesterone to support the uterine lining. 84. A woman is most fertile just before ovulation. True or false? Answer: true. Rationale: the fertile window typically occurs in the days leading up to and including ovulation, when the egg is released and can be fertilized by sperm. 85. Human eggs are capable of fertilization for only a short time after ovulation, typically 12 to 24 hours. True or false? Answer: true. Rationale: after ovulation, an egg remains viable for fertilization for a short period, 12 to 24 hours. If not fertilized during this window, it degenerates and is absorbed by the body. 86. The epididymis is where sperm mature and are stored until ejaculation. True or false? Answer: true. Rationale: the epididymis is the site where sperm mature and are stored. Sperm are transported from the testes to the epididymis via the seminiferous tubules. 87. The clitoris is part of the internal reproductive organs of females. True or false? Answer: false. Rationale: the clitoris is an external organ in females and plays a key role in sexual arousal. It is located at the top of the vulva, above the urethral opening. 88. The vas deferens is responsible for transporting sperm from the epididymis to the urethra. True or false? Answer: true. Rationale: the vas deferens is a tube that transports sperm from the epididymis to the urethra during ejaculation. 89. Menstrual blood is composed solely of blood. True or false? Answer: false. Rationale: menstrual blood is a combination of blood, cervical mucus, vaginal secretions, and sloughed-off endometrial tissue. 90. Ovarian reserve refers to the number and quality of eggs remaining in the ovaries. True or false? Answer: true. Rationale: ovarian reserve refers to the quantity and quality of a woman's eggs, which decreases with age and can affect fertility. 91. During ejaculation, the majority of seminal fluid is produced by the prostate gland. True or false? Answer: false. Rationale: most seminal fluid is produced by the seminal vesicles, not the prostate. The prostate contributes a small amount of fluid that helps nourish and protect sperm. 92. The amniotic sac provides a protective cushion for the developing fetus. True or false? Answer: true. Rationale: the amniotic sac, filled with amniotic fluid, provides protection, cushioning, and helps regulate temperature for the developing fetus. 93. Sperm are produced continuously throughout a man's life. True or false? Answer: false. Rationale: sperm production begins at puberty and continues throughout life, but the quantity and quality of sperm decline with age. 94. The urethra serves both as a passage for urine and semen in males. True or false? Answer: true. Rationale: the male urethra has dual functions. It serves as a conduit for urine from the bladder and for semen during ejaculation. 95. A woman can become pregnant if sperm are deposited in the vagina outside the fertile window. True or false? Answer: false. Rationale: pregnancy is most likely when sperm are deposited within the fertile window, which is just before or during ovulation, as the egg is viable for a short period after ovulation. 96. The zona pellucida is important in preventing polyspermy, the fertilization of an egg by multiple sperm. True or false? Answer: true. Rationale: the zona pellucida is a glycoprotein layer surrounding the egg. After the first sperm penetrates, it undergoes changes that prevent additional sperm from fertilizing the egg. 97. A typical pregnancy lasts about 38 weeks from fertilization. True or false? Answer: true. Rationale: a typical pregnancy lasts about 38 weeks from fertilization, although the full term is often considered to be 40 weeks from the first day of the last menstrual period. 98. In males, the Leydig cells produce testosterone. True or false? Answer: true. Rationale: Leydig cells, located in the testes, produce testosterone, which is important for male sexual development and spermatogenesis. 99. The release of luteinizing hormone, LH, triggers ovulation in females. True or false? Answer: true. Rationale: a surge in LH levels is the key trigger for ovulation, causing the mature follicle to release the egg from the ovary. 100. The inner layer of the uterus, the endometrium, thickens in response to estrogen during the menstrual cycle. True or false? Answer: true. Rationale: the endometrium thickens in response to estrogen during the follicular phase of the menstrual cycle, preparing for potential embryo implantation. 101. Menopause occurs when the ovaries stop producing eggs and estrogen. True or false? Answer: true. Rationale: menopause is the natural biological process that occurs when the ovaries cease to produce eggs and significantly reduce estrogen production, typically around age 50. 102. Ovulation is the process in which an egg is released from the corpus luteum. True or false? Answer: false. Rationale: ovulation is the release of an egg from a mature follicle, not from the corpus luteum. The corpus luteum forms after ovulation and secretes progesterone to support a potential pregnancy. 103. During pregnancy, the placenta produces estrogen to support fetal growth. True or false? Answer: true. Rationale: the placenta produces estrogen during pregnancy, which helps support fetal growth, maintain the uterine lining, and regulate maternal blood flow. 104. The seminal vesicles produce a large portion of the fluid in semen, which contains fructose to nourish sperm. True or false? Answer: true. Rationale: the seminal vesicles produce a thick fluid rich in fructose, which provides energy for sperm and contributes to the majority of semen volume. 105. Estrogen and progesterone levels rise during the follicular phase of the menstrual cycle. True or false? Answer: false. Rationale: estrogen rises during the follicular phase, but progesterone levels remain low until the luteal phase after ovulation. 106. The blood-testis barrier is formed by tight junctions between Sertoli cells in the testes. True or false? Answer: true. Rationale: the blood-testis barrier is a selective permeability barrier formed by tight junctions between Sertoli cells, protecting developing sperm cells from harmful substances in the blood. 107. The prostate gland is part of the male reproductive system and contributes to semen production. True or false? Answer: true. Rationale: the prostate gland is part of the male reproductive system. It produces an alkaline fluid that contributes to the volume of semen, providing a medium for sperm to survive in the acidic environment of the female reproductive tract. 108. The testicles are responsible for producing testosterone and estrogen. True or false? Answer: false. Rationale: the testicles produce testosterone, not estrogen. While small amounts of estrogen are present in males, It is primarily produced by the ovaries in females. 109. The cervix is the most flexible part of the female reproductive system, allowing it to dilate during childbirth. True or false? Answer: true. Rationale: the cervix is composed of flexible muscle and connective tissue, allowing it to dilate significantly during labor to permit the passage of the baby. 110. FSH, follicle-stimulating hormone, is important for the development of follicles in females and sperm production in males. True or false? Answer: true. Rationale: in females, FSH stimulates the development of ovarian follicles. In males, it stimulates the Sertoli cells to support sperm production. 111. The menstrual cycle is controlled by a feedback loop between the ovaries, hypothalamus, and pituitary gland. True or false? Answer: true. Rationale: the menstrual cycle is regulated by hormonal signals between the ovaries, hypothalamus, and pituitary gland, creating a feedback loop that controls the secretion of FSH, LH, estrogen, and progesterone. 112. The primary function of the ovaries is the production of estrogen and progesterone. True or false? Answer: true. Rationale: the ovaries produce estrogen and progesterone, which are critical for regulating the menstrual cycle and supporting pregnancy. 113. The vas deferens is responsible for producing sperm in males. True or false? Answer: false. Rationale: the vas deferens is not involved in sperm production. It is responsible for transporting sperm from the epididymis to the urethra during ejaculation. Sperm is produced in the seminiferous tubules of the testes. 114. The outer layer of the uterus, the perimetrium, is a muscular layer that contracts during labor. True or false? Answer: false. Rationale: the outer layer of the uterus is the perimetrium, which is a thin serous membrane. The muscular layer, called the myometrium, contracts during labor to help expel the fetus. 115. A sperm cell is composed of a head, midpiece, and tail. True or false? Answer: true. Rationale: a sperm cell consists of three main parts: the head containing the nucleus and acrosome, the midpiece, with mitochondria for energy, and the tail for motility. 116. Estrogen levels peak just before ovulation in females. True or false? Answer: true. Rationale: estrogen levels rise sharply just before ovulation, stimulating the release of luteinizing hormone, LH, that triggers ovulation. 117. The external genitalia of males is composed of the scrotum and penis. True or false? Answer: true. Rationale: the external genitalia of males includes the scrotum, which houses the testes, and the penis, which delivers sperm during ejaculation. 118. The fimbriae of the fallopian tube help propel the egg from the ovary into the tube. True or false? Answer: true. Rationale: the fimbriae are finger-like projections at the end of the fallopian tube that help capture the egg from the ovary and direct it into the tube for potential fertilization. 119. The acrosome of the sperm cell contains enzymes that help it penetrate the egg. True or false? Answer: true. Rationale: the acrosome is a cap-like structure on the sperm head that contains enzymes needed to break down the zona pellucida of the egg during fertilization. 120. The luteal phase begins immediately after ovulation and ends with the start of menstruation. True or false? Answer: true. Rationale: the luteal phase starts after ovulation and ends when progesterone levels drop, leading to the shedding of the endometrial lining, menstruation, if pregnancy does not occur. 121. A woman can only become pregnant during the luteal phase of the menstrual cycle. True or false? Answer: false. Rationale: pregnancy can only occur if sperm fertilize an egg, which happens around ovulation, not during the luteal phase. The luteal phase is the period following ovulation and before menstruation. 122. A vasectomy is a permanent form of male contraception that involves cutting the vas deferens. True or false? Answer: true. Rationale: a vasectomy involves cutting or blocking the vas deferens, preventing sperm from being released during ejaculation, and is considered a permanent form of contraception. 123. The endometrium is shed during menstruation if implantation of a fertilized egg does not occur. True or false? Answer: true. Rationale: if pregnancy does not occur, the endometrium, which thickens in preparation for embryo implantation, is shed during menstruation. 124. The prostate gland contributes to the formation of the blood-testis barrier. True or false? Answer: false. Rationale: the blood-testis barrier is formed by tight junctions between Sertoli cells in the seminiferous tubules of the testes, not by the prostate gland. 125. Follicle-stimulating hormone FSH stimulates the production of estrogen in females. True or false? Answer: true. Rationale: FSH stimulates the growth of ovarian follicles, which in turn produce estrogen during the follicular phase of the menstrual cycle. 126. The placenta is responsible for the production of all the hormones needed to maintain pregnancy. True or false? Answer: false. Rationale: while the placenta produces several key hormones, e.g., HCG, progesterone, estrogen, it does not produce all the hormones needed for pregnancy. The ovaries also contribute, particularly during the early stages of pregnancy. 127. In females, LH, luteinizing hormone, stimulates the maturation of ovarian follicles. True or false? Answer: false. Rationale: FSH stimulates the growth and maturation of ovarian follicles. LH is responsible for triggering ovulation once the follicles are mature. 128. During ovulation, the egg is released from the corpus luteum. True or false? Answer: false. Rationale: the egg is released from the mature follicle during ovulation, not the corpus luteum. The corpus luteum forms after ovulation and secretes progesterone to support pregnancy. 129. A woman's body temperature slightly increases after ovulation due to elevated progesterone levels. True or false? Answer: true. Rationale: after ovulation, progesterone levels rise, which causes a slight increase in body temperature, a marker that can help track ovulation. 130. The seminiferous tubules in the testes are where sperm are stored. True or false? Answer: false. Rationale: sperm are produced in the seminiferous tubules, but they're stored and matured in the epididymis. 131. The cervix produces mucus that changes consistency throughout the menstrual cycle to facilitate or prevent sperm entry. True or false? Answer: true. Rationale: the cervix produces mucus that becomes thinner and more alkaline around ovulation, facilitating sperm entry into the uterus. The mucus is thicker and more acidic during other times of the menstrual cycle to prevent sperm from entering. 132. The acrosome reaction is triggered when the sperm comes into contact with the zona pellucida. True or false? Answer: true. Rationale: the acrosome reaction is a process in which enzymes from the sperm's acrosome are released to break down the zona pellucida, allowing the sperm to penetrate the egg. 133. The testes are located in the abdominal cavity in males until they descend into the scrotum during fetal development. True or false? Answer: true. Rationale: the testes initially develop in the abdominal cavity and then descend into the scrotum before birth to maintain a cooler temperature for optimal sperm production. 134. Ovarian cysts are always cancerous and need to be surgically removed. True or false? Answer: false. Rationale: most ovarian cysts are benign and resolve on their own without the need for surgery. However, large or symptomatic cysts may require removal or monitoring. 135. In males, testosterone is essential for the development of secondary sexual characteristics such as facial hair and deeper voice. True or false? Answer: true. Rationale: testosterone plays a key role in the development of male secondary sexual characteristics, including facial hair, a deeper voice, and increased muscle mass. 136. The egg's zona pellucida is important for sperm binding during fertilization. True or false? Answer: true. Rationale: the zona pellucida is a glycoprotein layer surrounding the egg that binds to sperm and plays a critical role in fertilization. 137. The myometrium is the layer of the uterus responsible for the contractions that help expel the fetus during labor. True or false? Answer: true. Rationale: the myometrium is the muscular layer of the uterus that contracts during labor to help push the baby out. 138. The hormone oxytocin is involved in the initiation of labor and milk ejection. True or false? Answer: true. Rationale: oxytocin stimulates uterine contractions during labor and also facilitates milk ejection during breastfeeding. 139. In males, the seminal vesicles produce alkaline fluid to neutralize the acidity of the female reproductive tract. True or false? Answer: true. Rationale: the seminal vesicles produce an alkaline fluid that helps neutralize the acidity of the vagina, providing a more favorable environment for sperm survival. 140. During the follicular phase, the pituitary gland releases high levels of progesterone to support the growing follicle. True or false? Answer: false. Rationale: during the follicular phase, the pituitary gland releases FSH and LH, but progesterone levels remain low. Progesterone rises during the luteal phase after ovulation. 141. The primary function of the prostate gland is to produce sperm. True or false? Answer: false. Rationale: the prostate gland does not produce sperm. Its main function is to secrete a fluid that nourishes and protects sperm. Sperm is produced in the seminiferous tubules of the testes. 142. The menstrual phase of the menstrual cycle is marked by the shedding of the endometrial lining. True or false? Answer: true. Rationale: the menstrual phase occurs when the endometrial lining sheds because pregnancy has not occurred, marking the start of a new menstrual cycle. 143. The placenta produces human chorionic gonadotropin, HCG, to maintain the corpus luteum in early pregnancy. True or false? Answer: true. Rationale: HCG, produced by the placenta after fertilization, helps maintain the corpus luteum, which in turn produces progesterone to support pregnancy in the early stages. 144. In males, the Sertoli cells are responsible for the production of testosterone. True or false? Answer: false. Rationale: Sertoli cells support sperm development, but testosterone is produced by the Leydig cells in the testes. 145. The ovaries are located in the pelvic cavity, near the lateral walls of the uterus. True or false? Answer: true. Rationale: the ovaries are located on either side of the uterus in the pelvic cavity and are connected to the uterus by the ovarian ligaments. 146. The release of an egg from the ovary is triggered by a surge in FSH levels. True or false? Answer: false. Rationale: the surge in luteinizing hormone, LH, not FSH, triggers ovulation, causing the mature follicle to release the egg. 147. In females, the endometrial lining thickens in response to progesterone during the luteal phase. True or false? Answer: true. Rationale: during the luteal phase, progesterone is released by the corpus luteum, promoting further thickening of the endometrial lining in preparation for potential embryo implantation. 148. The epididymis is where sperm mature and gain motility. True or false? Answer: true. Rationale: sperm mature and develop motility in the epididymis, which is a coiled tube located on the back of each testis. 149. The fertilization of an egg typically occurs in the uterus. True or false? Answer: false. Rationale: fertilization usually occurs in the fallopian tube, not the uterus, when sperm meets the egg. The fertilized egg then travels to the uterus for implantation. 150. The luteal phase of the menstrual cycle ends when the corpus luteum degenerates and progesterone levels drop. True or false? Answer: true. Rationale: the luteal phase ends with a degeneration of the corpus luteum, leading to a drop in progesterone levels, which causes the shedding of the endometrial lining, menstruation, if no pregnancy occurs. 151. Menstrual bleeding is caused by a lack of progesterone. True or false? Answer: true. Rationale: if fertilization does not occur, progesterone levels drop, causing the uterine lining to break down and be shed as menstrual bleeding. 152. Oocytes in females are produced continuously throughout life. True or false? Answer: false. Rationale: females are born with a finite number of oocytes and no new oocytes are produced after birth. The number of oocytes declines as women age. 153. A woman is most fertile when her cervical mucus is thick and sticky. True or false? Answer: false. Rationale: the most fertile period is when the cervical mucus is thin and slippery, which facilitates the passage of sperm into the uterus. Thick, sticky mucus occurs at other times and may hinder sperm movement. 154. During pregnancy, the growing fetus is nourished through the placenta, which connects to the mother's blood supply. True or false? Answer: true. Rationale: the placenta facilitates nutrient and waste exchange between the mother and fetus via the umbilical cord, supporting fetal growth and development. 155. The female reproductive system undergoes puberty and menstruation cycles only once in a lifetime. True or false? Answer: false. Rationale: the female reproductive system experiences multiple menstrual cycles throughout a woman's life, with menstruation continuing until menopause, typically around age 50. 156. Testosterone plays an essential role in the development of male secondary sexual characteristics. True or false? Answer: true. Rationale: testosterone is crucial for the development of male secondary sexual characteristics such as deepening of the voice, growth of facial and body hair, and increased muscle mass. 157. A spike in luteinizing hormone, LH, during the menstrual cycle causes the release of an egg from the ovary. True or false? Answer: true. Rationale: the LH surge triggers ovulation, causing the mature follicle to release an egg from the ovary. 158. The amniotic fluid serves as a shock absorber to protect the fetus during pregnancy. True or false? Answer: true. Rationale: amniotic fluid cushions the fetus, protecting it from physical injury and helping maintain a stable temperature and environment. 159. During pregnancy, the hormone progesterone helps to prevent uterine contractions and maintain pregnancy. True or false? Answer: true. Rationale: progesterone, produced by the corpus luteum and later by the placenta, helps maintain the uterine lining and prevents premature uterine contractions during pregnancy. 160. Ovarian follicles contain eggs that can be fertilized once they mature. True or false? Answer: true. Rationale: each ovarian follicle contains an immature egg, oocyte. As the follicle matures, it prepares to release the egg during ovulation, making it available for fertilization. 161. Menopause is a condition in which a woman stops producing estrogen entirely. True or false? Answer: false. Rationale: during menopause, estrogen production decreases significantly, but it is not entirely eliminated. Small amounts of estrogen continue to be produced by other tissues, such as the adrenal glands. 162. In females, the vagina is the site of fertilization. True or false? Answer: false. Rationale: fertilization typically occurs in the fallopian tubes, not the vagina. The sperm travel through the cervix and uterus to reach the fallopian tubes, where they may fertilize an egg. 163. The vas deferens is part of the male reproductive system and is responsible for the production of sperm. True or false? Answer: false. Rationale: the vas deferens transports sperm from the epididymis to the urethra during ejaculation, but it does not produce sperm. Sperm are produced in the testes. 164. In females, the release of the egg from the ovary is triggered by a surge in estrogen levels. True or false? Answer: false. Rationale: the release of the egg is triggered by a surge in luteinizing hormone, LH, not estrogen. Estrogen levels peak just before this LH surge. 165. In males, a low level of testosterone may lead to decreased sperm production. True or false? Answer: true. Rationale: testosterone plays a critical role in spermatogenesis. Low testosterone levels can result in reduced sperm production and male infertility. 166. A woman is considered infertile if she has been unable to conceive after 6 months of trying. True or false? Answer: false. Rationale: infertility is generally diagnosed after 1 year of trying to conceive without success, or 6 months if the woman is over 35. 167. The male reproductive system includes the testes, seminal vesicles, and prostate gland. True or false? Answer: true. Rationale: the male reproductive system consists of the testes, sperm production, seminal vesicles, seminal fluid production, prostate gland, contributes to semen and other structures that support ejaculation and sperm transport. 168. Estrogen is the primary hormone responsible for the development of female secondary sexual characteristics. True or false? Answer: true. Rationale: estrogen is the primary hormone responsible for the development of female secondary sexual characteristics, such as breast development and widening of the hips. 169. The cervix is the lower part of the uterus that dilates during childbirth to allow the baby to pass through the birth canal. True or false? Answer: true. Rationale: the cervix is the lower part of the uterus that must dilate during labor to allow the passage of the baby through the birth canal. 170. The testes produce both sperm and semen. True or false? Answer: false. Rationale: the testes produce sperm, while semen, the fluid in which sperm are suspended, is made up of secretions from the prostate gland, seminal vesicles, and other glands. 171. The seminiferous tubules are responsible for the production of testosterone in males. True or false? Answer: false. Rationale: testosterone is produced by the Leydig cells, which are located outside the seminiferous tubules. The seminiferous tubules are responsible for sperm production. 172. The luteal phase of the menstrual cycle is characterized by the formation of the corpus luteum and an increase in progesterone levels. True or false? Answer: true. Rationale: after ovulation, the ruptured follicle forms the corpus luteum, which secretes progesterone to prepare the endometrium for possible implantation. 173. The female reproductive system is more prone to infections because of the proximity of the anus to the vagina. True or false? Answer: true. Rationale: the close proximity of the anus to the vagina increases the risk of bacterial infections, as bacteria from the rectum can potentially spread to the vaginal area. 174. Ovarian follicles are present in a female's ovaries at birth and increase in number throughout life. True or false? Answer: false. Rationale: females are born with a finite number of ovarian follicles. No new follicles are formed after birth, and their number decreases over time until menopause. 175. The fallopian tubes are the primary site for sperm maturation in females. True or false? Answer: false. Rationale: sperm maturation occurs in the epididymis, not the fallopian tubes. The fallopian tubes are the site where fertilization typically takes place. 176. The presence of a Y chromosome in a zygote determines male sex differentiation. True or false? Answer: true. Rationale: the presence of the Y chromosome leads to the development of male sex characteristics, including the formation of testes, which produce testosterone, essential for male differentiation. 177. Follicular stimulating hormone, FSH, is responsible for the production of estrogen in males. True or false? Answer: false. Rationale: in males, FSH stimulates the Sertoli cells in the testes to support sperm production, but it is LH that stimulates the Leydig cells to produce testosterone. 178. The myometrium is the innermost layer of the uterus. True or false? Answer: false. Rationale: the myometrium is the middle muscular layer of the uterus responsible for uterine contractions. The innermost layer is the endometrium, which undergoes changes during the menstrual cycle. 179. The hormone prolactin is responsible for the production of milk in the mammary glands. True or false? Answer: true. Rationale: prolactin stimulates milk production in the mammary glands after childbirth, while oxytocin is responsible for milk ejection. 180. The clitoris is an external female reproductive organ primarily involved in sexual arousal. True or false? Answer: true. Rationale: The clitoris is the main organ involved in female sexual arousal, containing erectile tissue and a high concentration of nerve endings. 181. Sperm cells are produced in the seminiferous tubules and are then stored in the prostate gland. True or false? Answer: false. Rationale: sperm are produced in the seminiferous tubules and stored in the epididymis, not the prostate gland. The prostate contributes to semen production. 182. The placenta is the organ that supplies oxygen and nutrients to the fetus during pregnancy. True or false? Answer: true. Rationale: the placenta exchanges gases, nutrients, and waste between the mother and fetus, playing a crucial role in fetal development. 183. Progesterone levels remain high during pregnancy to prevent menstruation. True or false? Answer: true. Rationale: progesterone maintains the uterine lining and prevents menstruation during pregnancy. Its levels remain elevated to support pregnancy. 184. A woman can conceive if sperm is deposited in the vagina during the luteal phase of her menstrual cycle. True or false? Answer: false. Rationale: the most fertile time for conception is during ovulation, which typically occurs mid-cycle. Sperm can survive for several days, but the luteal phase is generally not the most fertile time. 185. The female external genitalia is also known as the vulva. True or false? Answer: true. Rationale: the vulva refers to the external genital structures of females, including the labia, clitoris, vaginal opening, and external urethral opening. 186. The uterus is divided into three parts: the fundus, body, and cervix. True or false? Answer: true. Rationale: the uterus has three main parts: the fundus, top; the body, middle; and the cervix, lower portion. 187. A hysterectomy is a surgical procedure that involves the removal of the ovaries. True or false? Answer: false. Rationale: a hysterectomy involves the removal of the uterus, not the ovaries. Removal of the ovaries is called oophorectomy. 188. The male reproductive system includes the seminal vesicles, prostate gland, and bulbourethral glands, which all contribute to semen production. True or false? Answer: true. Rationale: these glands contribute to semen production by secreting fluids that nourish and protect sperm. The seminal vesicles provide a significant portion of the semen fluid. 189. The hormone oxytocin is involved in the ejection of milk from the mammary glands. True or false? Answer: true. Rationale: oxytocin stimulates milk ejection from the mammary glands during breastfeeding. It is sometimes called the milk letdown hormone. 190. The endometrium thickens in response to estrogen during the follicular phase of the menstrual cycle. True or false? Answer: true. Rationale: estrogen stimulates the thickening of the endometrial lining during the follicular phase to prepare for potential implantation of a fertilized egg. 191. Menarche is the term used to describe the cessation of menstruation in women. True or false? Answer: false. Rationale: menarche refers to the first menstruation, marking the beginning of a woman's reproductive years. The cessation of menstruation is called menopause. 192. An ectopic pregnancy occurs when a fertilized egg implants outside the uterus, usually in a fallopian tube. True or false? Answer: true. Rationale: an ectopic pregnancy occurs when the fertilized egg implants outside the uterus, commonly in a fallopian tube, which can cause serious health risks if untreated. 193. In the male reproductive system, the prostate gland produces the majority of the semen. True or false? Answer: false. Rationale: while the prostate contributes fluid to semen, the majority of semen is produced by the seminal vesicles. 194. Spermatogenesis is the process of sperm production that occurs in the testes. True or false? Answer: true. Rationale: spermatogenesis is the process by which sperm are produced in the seminiferous tubules of the testes, beginning with spermatogonia and ultimately resulting in mature sperm cells. 195. The hormone relaxin is produced during pregnancy and helps soften the cervix in preparation for childbirth. True or false? Answer: true. Rationale: Relaxin is a hormone produced during pregnancy that helps relax the ligaments of the pelvis and soften the cervix in preparation for childbirth. 196. The prostate gland is located just below the bladder in males. True or false? Answer: true. Rationale: the prostate gland is located beneath the bladder and surrounds the urethra, playing a role in the production of semen. 197. The male urethra serves only as a passageway for urine. True or false? Answer: false. Rationale: the male urethra serves as a passageway for both urine and semen, carrying urine from the bladder and semen from the reproductive system. 198. A woman's menstrual cycle can be regulated by oral contraceptives, which contain synthetic hormones. True or false? Answer: true. Rationale: oral contraceptives contain synthetic hormones, estrogen and/or progestin, that regulate the menstrual cycle by inhibiting ovulation and altering the endometrial lining. 199. The function of the bulbourethral glands is to produce the majority of semen. True or false? Answer: false. Rationale: the bulbourethral glands produce a small amount of fluid that lubricates the urethra for sperm passage. The majority of semen is produced by the seminal vesicles and prostate gland. 200. The placenta is responsible for the production of all the hormones that regulate pregnancy. True or false? Answer: false. Rationale: while the placenta produces several hormones critical to pregnancy, such as HCG, progesterone, and estrogen, it does not produce all hormones. The ovaries also contribute, especially early in pregnancy. 201. During the menstrual cycle, the endometrium thickens in preparation for implantation of a fertilized egg. True or false? Answer: true. Rationale: the endometrium thickens during the menstrual cycle, particularly in response to estrogen during the proliferative phase, in preparation for implantation of a fertilized egg. 202. The corpus luteum secretes estrogen and progesterone to maintain pregnancy in the early stages. True or false? Answer: true. Rationale: the corpus luteum secretes progesterone and estrogen, which maintain the uterine lining during early pregnancy and prevent menstruation. 203. The female reproductive system includes the uterus, ovaries, fallopian tubes, and external genitalia, but not the cervix. True or false? Answer: false. Rationale: the cervix is an essential part of the female reproductive system. It connects the uterus to the vagina and plays a key role in childbirth and menstruation. 204. Testicles are responsible for both the production of sperm and the secretion of testosterone in males. True or false? Answer: true. Rationale: the testes produce sperm in the seminiferous tubules and secrete testosterone in the Leydig cells, both critical to male fertility and secondary sexual characteristics. 205. The fallopian tubes are lined with ciliated cells that help move the egg toward the uterus. True or false? Answer: true. Rationale: the fallopian tubes are lined with ciliated epithelial cells that help propel the egg from the ovary toward the uterus, aiding in the process of fertilization. 206. The Graafian follicle ruptures during ovulation to release a mature egg. True or false? Answer: true. Rationale: the Graafian follicle is the mature follicle that ruptures during ovulation to release a mature egg, which is then available for fertilization. 207. Progesterone is the hormone responsible for stimulating the development of secondary sexual characteristics in females. True or false? Answer: false. Rationale: estrogen is the primary hormone responsible for the development of secondary sexual characteristics in females, such as breast development and widening of the hips. Progesterone helps prepare the endometrium for implantation. 208. During pregnancy, the developing embryo is nourished by the yolk sac in early stages before the placenta forms. True or false? Answer: true. Rationale: during the early stages of pregnancy, before the placenta is fully developed, the yolk sac provides nutrients to the developing embryo. 209. The vas deferens transports sperm from the testes to the urethra during ejaculation. True or false? Answer: true. Rationale: the vas deferens is a duct that transports mature sperm from the epididymis to the urethra for ejaculation. 210. The acrosome of the sperm contains enzymes that help it penetrate the egg during fertilization. True or false? Answer: true. Rationale: the acrosome, a cap-like structure on the head of the sperm, contains enzymes such as hyaluronidase that help the sperm penetrate the egg's outer layers during fertilization. 211. The prepuce, or foreskin, is the outermost layer of skin covering the glans penis in males. True or false? Answer: true. Rationale: the prepuce, foreskin, covers the glans penis and can be retracted. It protects the sensitive glands and has a role in sexual function. 212. After fertilization, the zygote undergoes cleavage and eventually forms a blastocyst for implantation. True or false? Answer: true. Rationale: after fertilization, the zygote undergoes cleavage, rapid cell division, and forms a blastocyst, which implants in the endometrium of the uterus. 213. Testosterone levels remain high throughout the life of a male, from puberty to old age. True or false? Answer: false. Rationale: testosterone levels peak during puberty and decline gradually with age. Older men may experience lower levels of testosterone, leading to age-related changes like decreased libido or muscle mass. 214. The presence of two X chromosomes results in the development of female sex characteristics. True or false? Answer: true. Rationale: the presence of two X chromosomes leads to the development of female sex characteristics, while the presence of one X and one Y chromosome results in male differentiation. 215. A sperm cell contains a full set of chromosomes, similar to a regular body cell. True or false? Answer: false. Rationale: a sperm cell is a haploid cell, meaning it contains half the number of chromosomes, 23, compared to a regular body cell, 46 chromosomes. This allows for the formation of a diploid zygote when combined with the egg. 216. The zona pellucida is the outer layer of the egg that must be penetrated by sperm during fertilization. True or false? Answer: true. Rationale: the zona pellucida is the glycoprotein layer surrounding the egg. Sperm must penetrate this layer for fertilization to occur. 217. In the male reproductive system, the bulbourethral glands produce a fluid that neutralizes the acidity of the urine in the urethra prior to ejaculation. True or false? Answer: true. Rationale: the bulbourethral glands secrete a clear, alkaline fluid that neutralizes any residual acidity in the urethra, creating a more favorable environment for sperm during ejaculation. 218. The endometrial lining is shed if implantation of a fertilized egg does not occur. True or false? Answer: true. Rationale: if implantation does not occur, the corpus luteum degenerates, leading to a drop in progesterone, which causes the shedding of the endometrial lining, menstruation. 219. During labor, the hormone oxytocin stimulates uterine contractions. True or false? Answer: true. Rationale: oxytocin stimulates uterine contractions during labor, helping to facilitate the process of childbirth. It is also involved in milk ejection during breastfeeding. 220. The epididymis is where sperm are stored until they are ejaculated. True or false? Answer: true. Rationale: the epididymis stores and matures sperm until ejaculation. It is a coiled tube located on the surface of the testis. 221. The zona pellucida is the structure that holds sperm together during ejaculation. True or false? Answer: false. Rationale: the zona pellucida is a layer around the egg, not a structure involved in holding sperm together. Sperm are held together in the ejaculate by seminal fluid. 222. The menstrual cycle is typically 28 days long, but can vary from woman to woman. True or false? Answer: true. Rationale: while the average menstrual cycle is 28 days, it can vary among women and from cycle to cycle in the same woman, ranging from 21 to 35 days. 223. Estrogen helps to stimulate the development of the endometrial lining during the follicular phase of the menstrual cycle. True or false? Answer: true. Rationale: estrogen stimulates the thickening of the endometrial lining in preparation for a potential pregnancy during the follicular phase. 224. The prostate gland contributes to the alkaline component of semen, which helps protect sperm from the acidic environment of the vagina. True or false? Answer: true. Rationale: the prostate gland produces an alkaline fluid that neutralizes the acidic environment of the vagina, providing a more favorable environment for sperm survival. 225. The process of meiosis in females results in the formation of one functional egg and three polar bodies. True or false? Answer: true. Rationale: meiosis in females results in one large functional egg and three smaller polar bodies, which are not functional in fertilization. 226. After fertilization, the fertilized egg is referred to as a zygote until it implants in the uterus. True or false? Answer: true. Rationale: after fertilization, the fertilized egg is called a zygote. It then divides and becomes a blastocyst before implanting in the uterine lining. 227. The menstrual cycle is regulated by feedback mechanisms involving the hypothalamus, pituitary gland, and ovaries. True or false? Answer: true. Rationale: the menstrual cycle is regulated by hormonal feedback loops involving the hypothalamus, GnRH, the pituitary gland, FSH and LH, and the ovaries, estrogen and progesterone. 228. The male and female reproductive systems both require a specific set of hormones for reproductive health and function. True or false? Answer: true. Rationale: both male and female reproductive systems require a variety of hormones, including gonadotropins, FSH and LH, sex hormones, testosterone, estrogen and progesterone, and others to regulate gametogenesis, sexual function, and fertility. 229. The endometrium is the muscular layer of the uterus. True or false? Answer: false. Rationale: the endometrium is the innermost layer of the uterus and is composed of glandular tissue. The muscular layer is called the myometrium, which is responsible for uterine contractions during labor. 230. Ovulation typically occurs on the 14th day of a 28-day menstrual cycle. True or false? Answer: true. Rationale: ovulation usually occurs around the 14th day of a 28-day menstrual cycle, but this can vary among women or cycle to cycle. 231. The testes are located outside the body to maintain a temperature that is optimal for sperm production. True or false? Answer: true. Rationale: the testes are located in the scrotum outside the body to maintain a temperature lower than the body's core temperature, which is necessary for the production of viable sperm. 232. During the luteal phase of the menstrual cycle, estrogen levels are at their peak. True or false? Answer: false. Rationale: during the luteal phase, progesterone levels peak due to the secretion of the corpus luteum, while estrogen levels are lower than during the follicular phase. 233. The primary function of the bulbourethral glands is to produce semen. True or false? Answer: false. Rationale: the bulbourethral glands produce a clear, lubricating fluid to prepare the urethra for sperm passage. The seminal vesicles and prostate contribute to the bulk of semen. 234. Sperm cells are capable of fertilizing an egg immediately after being produced in the testes. True or false? Answer: false. Rationale: sperm must undergo maturation in the epididymis to gain the ability to fertilize an egg. This process can take several days. 235. The placenta acts as a barrier to protect the fetus from harmful substances. True or false? Answer: false. Rationale: while the placenta does filter some harmful substances, it is not a perfect barrier. Certain harmful substances, like drugs, alcohol, and some infections, can pass through the placenta and affect the fetus. 236. The acrosome reaction is triggered when sperm contacts the egg's zona pellucida during fertilization. True or false? Answer: true. Rationale: the acrosome reaction is a process where enzymes from the acrosome are released to help sperm penetrate the egg's zona pellucida, allowing fertilization to occur. 237. The prostate gland produces the majority of semen fluid in males. True or false? Answer: false. Rationale: the seminal vesicles produce the majority of the fluid in semen. The prostate gland contributes a smaller portion, which is rich in enzymes, zinc, and other components. 238. A woman who has a high level of luteinizing hormone, LH, at mid-cycle is likely to be ovulating. True or false? Answer: true. Rationale: a surge in LH is a key trigger for ovulation, which typically occurs about 24 to 36 hours after the LH peak. 239. The cervix dilates during pregnancy to facilitate sperm entry into the uterus. True or false? Answer: false. Rationale: the cervix remains closed and firm during pregnancy to protect the fetus. It dilates during labor to allow the passage of the baby. 240. Spermatogenesis occurs in the seminiferous tubules of the testes. True or false? Answer: true. Rationale: spermatogenesis, the process of sperm production, occurs in the seminiferous tubules within the testes. 241. The mammary glands are located in the ovaries and are responsible for the production of milk. True or false? Answer: false. Rationale: the mammary glands are located in the breasts, not the ovaries. They produce milk after childbirth, under the influence of hormones like prolactin and oxytocin. 242. The process of meiosis in males results in the formation of 4 genetically identical sperm cells. True or false? Answer: false. Rationale: meiosis in males results in the formation of 4 genetically distinct sperm cells, each with half the number of chromosomes. 243. The release of human chorionic gonadotropin, HCG, from the placenta signals the beginning of pregnancy. True or false? Answer: true. Rationale: HCG is produced by the placenta after implantation and helps maintain the corpus luteum, which continues to secrete progesterone to sustain the pregnancy. 244. The fallopian tubes are the site where sperm are produced in females. True or false? Answer: false. Rationale: the fallopian tubes are not the site of sperm production. They serve as the passageway for eggs from the ovaries to the uterus and are the site where fertilization typically occurs. 245. The menstrual cycle is regulated primarily by the interaction of estrogen and progesterone. True or false? Answer: true. Rationale: the menstrual cycle is regulated by the interplay of estrogen and progesterone, which control the phases of the cycle and prepare the uterus for pregnancy. 246. Oogenesis, the process of egg production, occurs throughout a woman's life. True or false? Answer: false. Rationale: oogenesis begins during fetal development and is arrested in prophase I until puberty. After puberty, eggs are released monthly, but no new eggs are produced after birth. 247. The external genitalia in males is collectively called the scrotum. True or false? Answer: false. Rationale: the scrotum is part of the male external genitalia and houses the testes, but the entire external genitalia, including the penis, is called the male genitalia. 248. After fertilization, the zygote begins to divide through mitosis to form a blastocyst. True or false? Answer: true. Rationale: after fertilization, the zygote divides through mitosis, and as cell divisions continue, it forms a blastocyst, which is capable of implanting into the uterus. 249. Polycystic ovary syndrome, POS, is characterized by irregular ovulation, excess androgen production, and ovarian cysts. True or false? Answer: true. Rationale: POS is a common endocrine disorder in women characterized by irregular menstrual cycles, elevated levels of androgens, male hormones, and the presence of multiple ovarian cysts. 250. A vasectomy involves the removal of the prostate gland. True or false? Answer: false. Rationale: a vasectomy involves the surgical cutting or blocking of the vas deferens, preventing sperm from being ejaculated. The prostate gland is not involved in this procedure.